Hey pre-med star, this is Dr. Norton, and these are my 5 questions. First, what is your specialty and what training was needed for you to become that? I'm actually still in fellowship. I'm doing a fellowship in pulmonary and critical care medicine. So it starts obviously with your 4 years of medical school, followed by 3 years of internal medicine training. And then at the end of that, you go into fellowship, which for me is 3 or 4 years, depending on what you want to do with your life. So for me, I want to stay in academic medicine, do pulmonary critical care medicine at a university setting, so it'll be a 4-year program for me. Number 2, describe a typical day on the job in 30 seconds or less. The nice thing about pulmonary and critical care, what kind of drew me to the field, is you can kind of do with it whatever you want. So you can do anything from outpatient pulmonary medicine to predominantly critical care and ICU work. So for me, I like a little bit of a mix. So for me, it would be a day in clinic a week, and then several days straight in the intensive care unit, and maybe some pulmonary consults on the inpatient setting. So a little bit of everything. Number 3, what was your biggest challenge on your journey to becoming a medical doctor? I think for me, I have 2 kids now and a wife, and one of the toughest things you'll find starting in medical school and on up is time management and trying to find time for studying and time to have a life outside of medicine, and for me, time for spending with my wife and kids. So really upfront working on time management and figuring out what's important to you and how you're going to make that work is important. Number 4, share one of your most memorable medical moments. For me, it's not a single moment, but I think medicine's about the relationships that you build. And I currently have a gentleman that I follow in pulmonary clinic who has quite advanced lung disease. And when I see him, I see him about once a month, and sometimes more if he's not doing very well. And oftentimes his wife and his daughter come in with him, and the relationship that I've built with his family and kind of taking care of him in some of his toughest times has been very rewarding and something that I'll never forget. And finally, what is the single biggest piece of advice you had for pre-meds? My piece of advice is one that I learned the hard way, and it's follow your heart. You know you best, so don't let something that somebody else is interested in make you think that that's the right thing for you. Know what you like and what you don't like, and pick a field based on that. So if you're not interested in outpatient medicine, then don't do dermatology or family medicine. If you really want to be home on all weekends, don't pick necessarily internal medicine or things like that. So really know what's important to you, what makes you happy, what setting that is, and follow your heart. It's not always about the money. It's not always about the sexy lifestyle that the surgeons are going to have and things like that. Know what's important to you. Follow your heart. Don't let other people sway you when you really know what's best for you. Hope that's helpful. Enjoy talking to you guys, and take care.